Especially, which is very important with a pregnant woman, is a diaphragm. It's very important to be sure these vessels are able to expand. It will impact the birth by itself and delivery. I'm David, I'm from France. It's gonna be like 11 years now I live in Japan and practicing osteopathy here. As an osteopath, basically what we do is we take care of people in need. Osteopathy is basically a manipulative treatment, which means we use our hand to diagnose and feel what's wrong in the body and to fix it, to give back function where there is a lack of function, which is linked to the mobility of each part of the body. So it's a very global approach, switching from foot to head. We may be able to check and feel and work on the different parts of the body from foot to head, organs included. First, us as osteopaths, we focus on the body and the function and the physiology of the body, compared to what in hospital we are looking for. It will be just to find disease, symptoms, and to fix the symptoms. Us, I would like to say, to make it more simple, we don't care much about like symptoms or disease. We just get the information as a tool, first for safety and to understand what's going wrong. But first, our point is to find dysfunction, lack of function in the body. So we care of the body, we don't care of disease. And we look by our hands, so lack of function, we test, we feel, and we just listen to what the body is telling to us and to make treatments adjusted to each patient. So in France, we study osteopathy like in a professional school, which means, for example, in France, it's like a 5 years training, where we learn about like medical theory. We learn about, like, of course, to training, like manipulative treatment training, and all kind of research and hospital training too, actually. So basically, how we develop our way of working is from a very basic, like testing and testing, like functional testing, and of course techniques we apply again and again. And of course, by the experience, you will develop a certain sensitivity, which makes your treatment as an osteopath compared to another one, which make each approach for each person will be kind of different based on our own feelings. So let's say we have a global common philosophy, but the way to apply this philosophy may be different from each osteopath. Especially for myself, because my way of working is not common and not academic at all. So which I developed from by my experience in clinic and all the sports, like professional sport men I was working with. The main reason could be, for example, trouble of like fertility, like couple who have trouble to have a baby. For example, they went to hospital, they have all kind of medical check, kind of test, physiologic test, and everything is okay. No reason why it's not working. But there may be a functional reason why there is no way to get a baby. And for this kind of reason, people may come to us. We could think about all kind of symptoms linked to pregnancy. So it can be, for example, physical pain because of the change of the posture. It can be from headaches, spine pain, muscle pain. It can be like sleeping disorder, reflux, stomach reflux, all kind of sciatica symptoms linked. Digestive trouble, of course, sleeping trouble. We focus on one thing. We are looking for a lack of function, and our point is to give back function. The lack of function means lack of mobility of each part of the body. We consider like where there is a lack of mobility of any part, we can think about muscle, we can think about like joints, organs. It means it's not working properly. So, and our point is to look for this, to feel it where the function is not good, and to give back mobility by all kind of technique. After, it's true for a pregnant woman, for example, usually our techniques are more like, let's say, soft, because we don't need much to use like strong technique most of the time. Just because of there is a specific reason, a physiological reason, because of the pregnancy, the hormonal balance is changing and makes the tissue more like, let's say, relaxed, easy to stretch. And because of this, like most of the techniques are very easy to apply. It's a global approach, which means we have to think globally from foot to head to look what's wrong, mechanically speaking, about the posture, about the function of the organs. We have to think about the circulation of the fluids and the nervous system, very important. A big part of the job for pregnant women is to prepare for the birth. Basically, we want to be sure, firstly, mechanically speaking, there is a good mobility in the hip, in the spine, which lets all the movement from the birth and going through in a different angle, different direction, to let the proper movement, to make it more simple and it's more smooth. After, I think about another reason people come to us is when what we say, a reverse position, when the baby is up and down, is like sitting position. We can have a very positive impact on it and to help the process of going back to physiological position of the baby. We focus a lot on the mechanic, which is the main thing firstly. So we want to be sure joints, muscle, and the bone structure of the skeleton has a good potential of movement, globally speaking. After we think about, of course, the muscle. If there is a need, we need to be sure muscle are able to get a good flexibility to let the movement going through. So same from foot to head, and especially, which is very important with a pregnant woman, is the diaphragm and the perineal muscle. So this, we say, horizontal muscle. So it's very important to be sure this one are able to expand, retraction expand properly. It will impact of course, the growth of the baby and second, the birth by itself and delivery. Personally, what I like to do is to focus on the mechanic of the hip. So I'm gonna test the hip, feel how it is, stimulate the function to give back and use some specific technique to be sure the hip is working well, in opening, rotation and sliding. So different direction of movement basically. So usually I start by this one. So I use different kind of technique, can be from mobilization. I like a vibrating technique because I have an ability to vibrate. So I use a lot of this one in a pregnant woman, which is very effective and very easy and soft. After I go back to the spine. So I test progressively, and where I feel there is a dysfunction, same, I work on it. It can depend on the technique. The technique I will use will depend on my feeling on what I feel for the patient. After, if legs, if need, for example, I focus on the muscle, so I check all the muscle of the hip, same, I check the diaphragm, as I told you, perineal muscle. What's important to focus on too is what we call the craniosacral system. Our craniosacral system is very specific to osteopathy. It's, let's say, to check and rebalance the inner membrane of the skull and the spine. So it's which is still from the sacrum lower part, going through the spine until inside the skull, until the front part. So basically this system can be disbalanced and may have an impact on the posture and the ability to open the system and to have a good breathing, what we call good breathing, going up, down, up, down. So we have a very soft and gentle technique to work on it. So basically this is an important tool too. And organs, of course, because organs, as you know, because of the baby has a growth which is very extremely quick and fast, the change is very important, and because of this the organs maybe have some compression, the breathing may be impacted, so we'll have, for example, lower bowel function. So we have techniques to work on it, to check and see what's wrong in a soft way. No need to be crazy, a strong. For pregnant women, basically I would suggest quicker is better. Anyway, you may be able to come, and as soon as possible, even if you have no symptoms, because it's always good to prepare in prevention, to do prevention treatment instead of working on something which may be very tight or very in dysfunctional mode. So after how many sessions is very depending on each person. I would recommend at least 2-3 sessions Usually this is how my philosophy works and my techniques work. But of course it's very individual. Sometimes we just need like one session to prepare the birth. Sometimes we need more. So it's very individual, but yeah, I would say like 2-3 sessions to have an idea. Basically, because of all the pregnancy and the delivery, there is so much like physiological change in a quick time impacted the body. So of course, a lot of this balance may come through because of this. So of course, the mechanic is changing, the posture is changing. So what we do is just we check how the mechanic works and we give back mobility, function, where there is something wrong, basically. After, we same as before, we want to be sure, like of course, the muscles are working properly. The organs same, because they change the pressure and all what impacts the circulation locally may be disturbed. So we want to be sure this is working properly. So we work on it too to give that good mobility, stimulating the circulation. And say always the same from foot to head. I mean, because of the posture, it's impacted from the lower spine to the upper one. So that's why we need to have always a global approach. Cranial system, same. Concerning babies, newborn, of course, osteopathy can help for this. My coworker, for example, is doing a lot. He's working a lot on babies. What's the reason mainly people come to us like for the baby, take care of the baby? Usually it's postural linked, so which means, for example, a habit of the baby to have let's say one position of the neck, for example, or the spine is always orientated in one direction, so we can work on it. To be sure like the skull has a good and harmonized mobility and shape, so we can work on it. Of course, it can go from sleeping trouble to eat, reflux, crying for no reason, digestive trouble. We can help for all kinds of symptoms. Yeah, so when it's about fertility, the main reason why women can't get pregnant properly, instead of having like negative medical check, is just because the endometrium is not, let's say, good quality. And because of this, the egg cannot stick, it doesn't stay in it. And so a big part of the work is to be sure the circulation and the quality of the blood circulating into the endometrium is good. So this is, from my point of view, the main thing I focus on for this kind of symptoms. We want to be sure for any reason, but we want to be sure that the function of the endometrium is good, circulation. For any inquiries, the best way to reach me basically is email or using like WhatsApp or Line from my website. You have direct link, it's maybe easy. Don't call me because I mostly never answer my phone, so I'm too busy for that. And but email or WhatsApp is very easy. And of course there is like an online agenda to book, and my colleague too, they are working the same way, so it's very smooth and easy.